Beauty and Bubbles with Glamour Bar. This week we have a special guest, Taylor Campbell with Restorative Injectables. But again, I'm Brandy, head of lots of things here. Mostly marketing, all things social, client services, and whatnot. We have Lindsay, our owner, and Ashley, lash expert, esthetician,
all the things.
Spray tanner, everything. She's amazing. But Taylor, give us a little more background on you.
So I am a nurse practitioner. I've been working in plastics for about 4 years now, and I recently, just about a month ago, had my 1 year anniversary of my practice, which is Restorative Injectables, and we do filler, Botox, B12, PRP, the vampire facial, kind of a whole realm of everything, and yeah, I love it. And I come to Glamour Bar once a month to inject because I love the girls here, and it's just really fun.
And we love having her here.
Yes.
So once a month, always check in with us because Taylor, we kind of vary a little bit on the time frames, but yeah, sometimes evenings, sometimes Saturday mornings. It just kind of depends. So.
And this Friday, right?
We have her coming in this Friday, the 14th, from 5 to 8. There are a few spots left still. And we're also going to be bringing out our custom lip bar, so you can make your own lipstick or lip gloss. And if you do Botox or filler, as well as a lip bar, you get 20% off of your custom lip bar that night. So it'll be a fun night.
So you can get your lippies injected and get a good lip gloss to go with them.
Yes.
Perfect. Awesome. So just a little housekeeping from last week. I know there was something that you wanted to follow up on, Lindsay. Do you want to go ahead and talk about that?
Sure. So last week we kind of got into the conversation of shampoos and conditioners that you purchase from Target and TJ Maxx, Marshalls, just to name a few. And so we would like to offer any of our clients or viewers, if you want to bring in your shampoos and conditioners, we will swap them out for our Unite product for a 30% discount. So that way you can try professional grade, kind of proven, we stand behind it, we'll guarantee the product for you, and you get to try it out for a great deal, because we know.
And you know exactly what you're getting.
Yes.
Not from Ross.
Right? Where you take the label off and it's like, Jergens.
That's so soft.
So we back our Unite products 100%. We talked a little bit last week about our favorite products of shampoo and conditioner. And so we'll be giving you guys that for 30% off if you want to, again, bring in your shampoo or conditioner or vice versa, either one. And then also, just as a little reminder, we're still raising funds for Lydia through the month of April. So Hope for Lydia is the hashtag if you want to look for it, or her GoFundMe, as well as a Facebook page. So 30% of any retail that we sell. We also have jars here and at our neighbor's Urban Dog for any donations that you want to give to the family through the month of April.
Awesome. Yeah, sounds good. And I just want to throw this out there. This week we are going to be giving away 10 units of Botox to anybody that follows Glamour Bar on Instagram, and as well as Taylor. So go ahead, and that will get you a chance to win 10 units of Botox. And we'll get into that later of how far that takes you and how much you'll need and whatnot. So we're going to get started with questions that we got in on social media and through email. But feel free to ask any questions in the comments during the live segment. Are you guys ready?
Ready.
Awesome. Are you ready?
You don't know. So right.
Yeah, you guys are ready.
I feel like they know.
We know all the things about Botox and filler.
All natural.
We're no strangers here. Am I right?
No, my first idea.
Perfect. So Taylor, our first question is, what age should you start Botox?
No.
Prevention is key, so we'll just start with that. There's really no perfect time to start. I think if there's an area that bothers you and you're 25, you can take care of it. There's no rules saying that you can't. I think most people start in their late 20s, early 30s, although I think the Kardashians have kind of changed the game. So everyone's starting a little bit younger. I notice my clientele getting younger and younger, especially with filler. But it's definitely preventative. So we know that if we're taking care of those muscles ahead of time and not having wrinkles, you are going to have better skin prevention moving on later in life. So I don't think there's an actual age. I just tell people if there's something that bothers you and I can help you fix that, why wait? I mean, that's kind of my
If you're asking that question, it's probably time.
Yeah.
Right, like if you're looking in the mirror and you have a line on your forehead that you want gone, I can probably get rid of it for you. So,
Well,
yeah.
Can I ask a question? I do have a question. Will a Botox stop working if you've used it for 30 years or filler? Like,
No, they always ask, does the skin change?
Yeah.
Do muscles change? Muscles atrophy over time, 100%, whether you're doing Botox or not. Your muscles are going to become more thin. I have 7-year-old patients who have been injecting since Botox probably wasn't even illegal. So I think there's no data saying that Botox, if you continue to use it, it's going to stop working or anything along those lines. So right now, we're in the clear.
I thought you said 7-year-old.
I thought 17.
70. Oh my gosh. My cutoff is 72, so I always say 70. That's when I stop injecting people, is about 72-ish.
Oh, really?
Yeah, because at that
time to
point...
give up?
No, it's not time to give up, but I think
job.
it is a lot harder to maintain because those muscles have atrophied.
Yeah.
So,
So we'll really
right after 72, we're not friends anymore.
Hey, you know what? Technology will come along.
yeah.
There will be
By
something
then,
else.
we'll
We
be
are
like,
evolving every day.
Yeah, we'll have
we'll
real
do
tight
face
face
swaps.
lips.
It'll be great.
Perfect. I
It's
think
a
that,
long way away.
Yeah.
Long, obviously.
well, I think that's a gateway to our next question on Botox. Just to let you know, Taylor just does not do Botox. I know there's a lot of questions about Botox, but she also does B12 injections, fillers, and we'll get into that as well. But does Botox hurt?
No, it's definitely, I think every patient is different, so whatever your pain tolerance is going to affect that. But for the most part, it's the smallest needle that we have. I use 32 gauge, which are the smallest needles that are out there, and they're only a 1/2 inch. So we're not going deep anyway into the skin. We can ice beforehand. We don't numb for Botox, but we can hold a little ice pack on there to numb the nerves around the area. For the most part, it's painless. You have a few little dots in certain areas where we inject, look just like little mosquito bites, and those go away in about 5 to 10 minutes after injecting. So no.
And if you guys are interested, so comment below. We might be doing a little live demonstration of Botox if you guys want to see it. And also it is like, I'm somebody that's terrified of needles and can't go to the doctor. I can't get a shot. I can't get my blood drawn, but the Botox needle's like so tiny.
It feels good.
And beauty is pain, people.
Yeah.
So
Beauty is pain.
it takes less than 5 minutes
And
to
you
do.
can feel it's working. I mean, it wouldn't feel like that. You know?
Yeah.
I like to feel it.
That doesn't hurt.
I don't mind it.
A little pain means a little beauty. Perfect. And how long does Botox last?
Most patients get about 3 to 4 months out of Botox. Some people may get longer, but the majority of patients are on a 3 to 4 month regimen. So it is a maintenance that you have to keep up. But if you think about it, just view it as a quarterly treatment and you'll get mainly 3 to 4 months out of it.
Perfect. And that also got gateways into our next question. What's the average cost of Botox?
It's measured per unit, so it depends on your facial structure, muscles, how strong those muscles are. Every patient's different. So I always tell people, just because your friend got 12 units, you may need 24. It doesn't mean that you're aging quicker than they are or anything like that. Everyone's face is different. So anatomy, all of those things go into play, and I make sure that I'm giving good facial assessment. I do what's necessary, but I don't overtreat those areas. So it just depends on the area, what the patient, how old they are, everything like that.
Awesome. So I feel like we've covered a lot on Botox. But let's move on to fillers. You said that was kind of like the new biggest trend for you, thanks to the Kardashians.
Yes.
Who
Good
doesn't
old
want
Kylie.
those big?
I mean, not everyone wants Kylie lips. I can, but I think they've just opened the door that filler is acceptable. Like, no one cares anymore if you do filler or you don't. I guess you just don't have to hide it as much, and I think they've made that more publicized because they show it on their TV show and everyone kind of understands why they look the way they do. It's absolutely filler. So I think it's one of those things. But yeah, definitely dermal fillers are the most popular thing that we do in my practice, mainly lip injections. That's a really big rave right now. And they look great. Everyone could use a little bit of a pout. It's subtle. It doesn't have to be over injected, so it can give you just a nice natural little lip.
Okay. And filler's great for a lot of other places too.
Right.
Like I'm jonesing to get my cheeks done.
Yes, so Voluma in the cheeks is a game changer. I just had mine done about 2 weeks ago. And it's great. It's preventative. It helps pick this skin up. So if you think about it, we're aging in this area because this portion of our skin is starting to sag. So if you can give your skin a little bit of a tack to pull back on. So I'll just use Ashley for an example because she's right here. So it's all about just pulling this back, and without giving you a cheek, you just get a nice contour here. So people also like that. Because makeup looks good, you photograph well, but it's preventative. So cheek fillers typically last about 2 years.
Awesome. Yeah. I'm going to go off of our list real quick. We had a great live question.
Yeah.
Brittany says, say you want Kylie lips, then years now, you decide you don't. Will your lips be stretched out or look different after you get them?
No, so filler is hyaluronic acid. So it pulls water in from the body. It only lasts about 8 months to a year. So let's say we go on a Kylie craze, and by the way, Kylie has like 6 syringes, so this doesn't happen overnight. So that would take about a year to do. You hate the filler, you want it out. 1, you can dissolve it out, or 2, your body will absorb that filler over time. And your lips, they do stretch while the filler is in there. But it's not like having a baby and that skin stretching. It's such a small pocket of skin, and the muscle works really well in that area, so it's going to go right back to where you are. So even if you decide in 5 years Kylie may not be as cool, I have a feeling that's going to happen. But it's not going to change anything. So you feel free, if you want to go big, you can go big.
So get yours done, Brittany.
Come on in, Brittany, Friday.
We'll see you Friday.
Perfect. That was a great question. And what is the average cost of a filler?
Filler can range anywhere from $350 to about $525. I do have syringes for patients because I think it's really important not to overwhelm a patient too quick with a ton of filler in their lips. So I like to do half syringes if we're just easing in. I tell people it's a marathon, not a sprint. We'll get there eventually. Or you can do a full syringe, and that's $525. Awesome. And that lasts about 8 months to a year.
Yeah. And I love that because previous world was in plastic surgery, and not a lot of people offer half syringes. So it's really great that Taylor does offer half syringes and does in moderation. I always tell like first timers, we have a lot of clients that are terrified of doing Botox or terrified of doing lip filler, and they don't want to have the Kylie lip right at first. They don't want people to know, and then this way they can kind of build up to it. So I love Taylor for that too.
Yeah, you can always layer. That's the good thing. So let's say you get a half syringe Friday, and next week you're like, I really want my lips bigger. We can add in another layer without causing any other issues to the area. So that's always really good. You can layer those products on top of each other.
Awesome. I don't want to pick on anybody, but Ashley,
Calling her out.
You know that it's going to be a pick-on situation.
Yeah. I know. You have had lip fillers, and you just got yours filled a couple weeks ago.
Yeah, right?
Yeah.
For my birthday.
For your birthday.
Mm-hmm.
And how do you feel about them? How is the pain as a client? Do you like them? This is your chance to bash Taylor if you want.
She wants to have the 6 fillers that Kylie has.
I can't get enough of it. It hurts, but Taylor's really good at numbing it. And every time she does a little prick, there's lidocaine in it, right?
Right.
So eventually your lips start to go a little numb, so the pain isn't as bad each little prick that you do. And I think I do I do a full?
You did. This last time we did, but we
Okay.
started out gradually with
Yeah.
Ashley's lips just because I hadn't injected her before
Yeah.
and we were starting. So we did a half, and then for her birthday we did a
Yeah.
full. And Ashley can handle a full syringe because she has good shape and there's room for that filler to go. So that's not for everyone. That's why you can't inject everyone the same way. But Ashley, I know her face. I've seen the movements there. I know kind of what to expect when we put filler in. So we did do a full syringe this last time of Juvederm Ultra, and they look amazing. They're full, they fit her face, but you would never probably look at her and think she has at least a syringe and a half in her lips.
Yeah.
So, perfect. So I look fabulous, and that's it. That's all you need to say. That's it. And you said Juvederm. Is there more types of fillers? What's the range and the difference, the most popular kinds?
There is. So there's a ton of fillers that you can use. I typically stick with Juvederm and Restylane and a little bit of Volbella for the lips, depending on the look that you're going for. If you don't want them very big, we use Volbella because it's a really small particle size. It smooths the lines in the lips without looking too big. And then Juvederm and Restylane are a little bit bigger particle size, so if you're wanting that Kylie lip, that's what we're going to use to accomplish that. So those are pretty typical. Those are my favorite ones. And it all depends on the person too. So just looking at their lips, and everywhere we put filler, it all just depends on the person's face.
Cool, awesome.
Yeah.
Another question for Brittany. She has lots of questions.
Brittany, I like you.
I feel like Brittany is going to make an appointment.
Yes, I think we'll see Brittany Friday. Just joking.
Should you start doing Botox before you start doing filler?
I think that's the common thing, and
right?
I think you should do Kybella. I think you should do it all. No, I do see that a lot, and I think that's a really good way to start. I think if you're not just coming in for a specific thing, like I just want my lips done, then I do think it's good to start with Botox because it gives you a taste of what the aesthetic world is like. And I promise you become addicted. So I just say, I don't mind just doing Botox because you always come back. So I'm confident in knowing that, and I think it's good. You get a little bit of Botox, you see what that does, even though they're two totally different mechanisms, it gives you the opportunity to experience it a little, and then you can always come back in for filler.
Awesome, yeah. Hope that answers all of your questions, Brittany.
I have a question.
Yeah.
Can I have a question?
You can have a question.
Tell us about Kybella and downtime and
So good.
when I should do it.
What is Kybella? I heard it, but I really don't know.
So Kybella started, it got FDA approval about a year ago, but the biggest campaign was that Khloe Kardashian came out and said, I've done 4 treatments of Kybella for the double chin. So it's for submental fat, even though in my practice I use it off-label all the time, don't tell anyone. But I do like to use it in other areas, small pockets of fat. It does permanently destruct the fat cells. So it's deoxycholic acid. It goes into this area. So I've also had this done, what a shocker. So when you look at someone from a front view, it's hard to really appreciate when someone has submental fat, but when you get that side profile of people,
right now
that's really those selfies, or when you're looking down and all of that, that is what it's for. Most people take about 2 treatments. We package as a kit because we've realized over time you need at least 2 to get full correction of that area. The good thing is it's permanent. It takes about 5 minutes to inject. It's the easiest filler or product that I use, not filler. There is some downtime though, so if you think about it, this small pocket of fat, we're putting a large amount of fluid in that area. So you kind of look like a bullfrog for a day. It's not cute, but you can definitely disguise it with certain looks, so scarves, things like that. If you have longer hair, just pull your hair up front is kind of what I did, and I just owned it. But it is great. It's the best thing because you don't have to have surgery. You don't even numb. You put ice there, you ice for 10 minutes, you do it, you're out the door. So it's less than 30 minutes overall, and their results are permanent. So if you go to my website or my Instagram, there's a ton of before and afters for Kybella.
Can you use it on other body parts?
Yeah.
Like
What other body
thighs, arms?
So you can use it here for this. I call this bra bella. So you know that fat you get when you put a sports bra on and you're like trying to be fit and work out, but then you just have that fat?
And let's be real, we're not really wearing our sports bra to work out. We're going to the grocery store.
We wear yoga pants to come to Glamour.
I also wear workout clothes. I don't work out in them.
Yeah.
So then you can do it above your knees for like this knee fat area right in here. I would show, but we won't even go there. And then in the thighs, so I call that thigh bella. So in the inner thighs, you can do it for that, which is really, really nice. So I've treated all of those things. I think it's really good here I don't care how skinny you are, look in the mirror, you have this. Like I know,
You do.
everyone has this. Like it's so hard to get rid of no matter how many push-ups you do or anything. So this is probably the most popular place we inject it.
And does the price differentiate?
So when you pocket is as two. So 2 treatments are about under $2,000. But if you think about it, this is a permanent treatment. So without anesthesia, without having to have liposuction, without having to do all of those things. So most of them range anywhere from $1,000 to $2,000.
Oh, that's okay.
Good.
Yeah.
Okay.
Yeah.
Done. All right, I got it. Let's do it.
Campbell,
doing it.
sign me up. All of it.
It's just pennies.
Perfect. And I want to go to another service that you offer is B12 injections.
Yeah.
Everybody's heard about them, but what are the benefits of them?
So B12 is really good because it's really hard to absorb through any sort of nutritional value. You don't get any foods, anything like that. It's really, really hard to absorb. So if you get it as an injection, you can do it in your arm or in kind of your hip area. It allows you to have increased metabolism. They say it's appetite suppressant. It's not actually going to suppress your appetite. Just by having a boost in metabolism, you're more energetic, you're not eating there as much. So when you see that, it's not actually suppressing the appetite. But the metabolism boosting those benefits, the energy levels overall, so you don't get those mid-afternoon spikes, you're kind of just more even kill. So you can do them once a week. I suggest doing them every week. You can take them home with you and do them. They're really beneficial.
She has like these awesome little packages of like little pre-made baby B12s that I've never seen before that are awesome.
They're so
So what does
good.
that run?
So those are $25, and then you can take them home as a package
A
for.
lot of things.
Ashley
I'm
knows
getting.
all these things, but tonight she's all about them. So you can take them home with you, and then you literally, I teach you how to inject them. They're super easy. They're actually in an insulin syringe. They come pre-made, so we actually use Pinnacle Pharmacy in Cherry Creek. They're amazing. They do all this for us. So they're really good. You take 4 home, which would be 100, or you can just do once a week and come into the office. It's whatever's more convenient for you, but they run $25.
And the pre-syringes are so awesome. I've gotten a lot of B12 like over the years, and these are like literally the tiniest little things ever. Like
Yeah, they're perfect.
you could totally inject them. You can do them in your arm. Usually B12 kind of hurts when you do it in the arm. These don't at all.
Where else would you inject B12 if you were doing it from home?
So if you do it from home, you typically would do it like if you're a diabetic or anything like that. So you find your belly button, you go 2 finger breaths over, you pinch the skin, swab with a little alcohol that I send you home with, and then you inject right there. And you rotate sides every week. If you have someone who will do it for you, you can do that. But I just do them to myself.
They're so
That's the best way.
Is there anybody that cannot do B12?
No, unless you would have some sort of autoimmune where you're overproducing B12, and that is typically a patient would know about that. We actually have you sign consents. You have a medical history that's filled out, so I go over that before I send you home with any B12, and it's just like you would get it in a medical office. So we would know those things, but it would only be an autoimmune disorder where you have an overproduction of B vitamins or anything like that.
Awesome, thank you. One question going back to lip fillers, I believe. I'm asking you since you're the expert. We have a comment from Rebecca. What is this new HA5 lip plump I've been hearing about?
Oh my gosh, it's so good. I think I may be one of the only places who have it, so I'm gonna really hang my hat on that right now. I think I ordered it right when it came out. So I'm pretty obsessed with HA5 in general, which is just a hyaluronic form. It's the same thing that's in the fillers, but the people who make filler Allergan came out with it as a skin product. It became so popular that they decided to use it as a lip plumper. So HA5 now comes, we sell it in a package of 2. It has the plumper, which has niacinamide, caffeine, green tea, so you're gonna get those really plump lips. And then you're gonna be able to put the HA5 in a lip gloss form on top of it. It's really amazing. So those retail for $68. They make perfect Mother's Day basket gifts. So we put them in like Easter baskets, Mother's Day gifts. They're really good. Any age can use those because everyone needs a lip plumper. Everyone needs that hyaluronate, which is going to pull water in, smooth out those lines. It's the best. So if you're gonna spend money on a lip plumper,
and how much is that?
She said 68.
So I think like people go to Sephora and buy all these like crazy lip plumpers or lip gloss and they feel like their lip's gonna fall off. This is not like that. It's so smooth. It's actually what you need to be using in that area, and it's really just another form of filler on top of your lips.
Just
Can somebody?
Yeah.
Can
No
somebody,
color, y'all. No color.
Can somebody use that that doesn't have fillers, or do you?
Definitely. So if you're not ready to get filler, but you love how your lips look with lip plumper, this is the perfect product for you.
I think I need
And
it.
cheaper.
I'll bring some on Friday.
Yes.
Yeah.
Please
Yes.
bring some on Friday.
And you get a travel size HA5 for your face when you purchase
I
it.
was like,
nice.
wait a minute. What's HA5 for the face?
Yeah.
Okay, so HA5
Literally,
is-
everybody is blowing up. What they want the HA5.
Yeah.
So
I
everybody
like
wants it.
it.
You can buy it on our website.
I need all the HA5.
It's so good. So if you think about it, all these fillers that we're putting into our face are hyaluronic acid. And there's new technology, the Vicross technology, which we love, and it doesn't pull as much water, but fillers are made out of hyaluronic acid. So Skin Medica came out with their product HA5, which is 5 forms of hyaluronate.
Wow.
No one on the market has that. So you can put it on your face once or twice a day. It literally feels like butter. You put it on, it's gonna fill in any fine lines. It's really plumping. It's amazing. So you can purchase that on our website.
Everybody's sending hearts. We need HA5. We're
It's
gonna sell you
HA5.
On
It's
Friday.
so good. I
You guys,
put it on
Friday,
before I came.
Friday.
It's so good. I'll bring a bunch on Friday, and we'll have them in cute little baskets here. You can purchase them on their own. Like I said, you get a free travel size HA5, so it'll give you the chance to try it for your face. It's the best.
Does the facial, sorry.
We need to know these questions too, you guys. We are learning with you.
Put it under moisturizer? Is it like a serum? How are you going to feel?
So it's not a serum, it's actually a little bit thicker. So when you lay it on your skin, it's going to be the consistency of a moisturizer.
Okay.
I like to put mine on in the morning because I feel like it almost acts as a primer.
Okay.
So I've gotten rid of my primer. I used to use Charlotte Tilbury and like all these fancy primers. So I've just nixed that out of my routine, which is one less step. I wash my face, put my vitamin C on, HA5, tinted moisturizer, I'm out the door. Super easy, and it just really, really plumps. I love it under the eyes. I put it on my lips now, but I don't have to anymore because we have the lip plumper. So
Oh my gosh, I can't wait for
can't wait.
HA5.
Does it have like any side effects? One person says, "Will it chap my lips after?"
no, but I know there's products that do that. So this won't. That's the good thing, is because the hyaluronate is pulling water in. So you're constantly getting that hydrated look, which is why it's so important. If you're going to use a lip plumper, this one makes perfect sense because you're counteracting what that chapping is doing by putting HA5 on.
So come plump your lips on Friday.
And then you can get a lip gloss on top of it.
yeah, and customize your own favorite lip gloss or
the
lipstick.
perfect thing.
Wow,
You
we're
get a
having.
lip plumper. and a
We're
gloss.
really getting like going on Friday. We really have something going here.
So
Okay, I have one last question from Brittany again.
Brittany, we love you.
We love you. We don't know her. She's just a viewer. That was a joke. One last question, and then we could do kind of like a live demonstration.
for sure.
Perfect. Brittany says, what's the best product or service to make skin look smooth, improve tone, and decrease visible pores, etc.?
So I think it takes a village to do all of those
Right.
things.
I wish there was one product.
One
that would be-
thing isn't going to take care of all of that. I think you have to use really good skincare lines. So Lindsay actually carries Revision, which is a dermatologist brand skincare line I'm obsessed with. I sell it in my office too. So that's one thing. You have to use medical grade skincare products, not products from Sephora. I love Sephora, but they don't have the high concentration and ingredients that you can get from physician dispensed products. So like Skin Medica is clinical.
Not to mention the science that's like put behind all of the medical grade skincare lines out there. They go through testing. They make sure it works.
Right,
It's
like
not just
PCA
like
is great. All of those things are really good products. So one, you need to use really good skincare products. Two, you need to have an esthetician, whether you see her quarterly, whether you see her monthly. I think quarterly. Shameless plug. Ashley does a ton of stuff here too. Depending on where you live, you can always find a really good esthetician. That will help cell turnover and that constant collagen reproduction. So I think good skincare, having an esthetician that can dermaplane you and get those dead cells off and get you fresh skin. Pore size is hard. It's probably, if we had an answer for that we would all be in a lot of shape.
Right now.
But there's a really good, there's really good lasers that you can do. In my office, I do the vampire facial to help with pore size. So I actually pull your blood, I spin it down in a centrifuge, I take the good part of that blood out, the platelet-rich plasma, and then we micro needle over the top of the skin, and that does help shrink pore size. But there's no proven science for anything to shrink pore size. I just think it takes a village. Improved texture and skin wrinkles. Botox can help a ton with that. It's going to tighten. And fillers can help any deformity. So nasolabial folds, anywhere down in here that you may have some laxity. So we call this the marionette lines. You can fill all those things, but I think it truly takes a village. And it's an investment, but it's your face. So I feel like
And products at Sephora and all of those places are not cheap. So
right. So if you're going to spend your money, I always tell people try to budget quarterly for at least some treatment, whether it's Botox or you're going to purchase a retinol that month, or you're going to see Ashley for a peel or something like that. There's always really good things that you can do. I just think you kind of have to budget and plan for those things.
Awesome. Thank you for all of that. Hopefully that answers your question, Brittany. And I have a question personally. Does the vampire facial hurt? It kind of sounds kind of painful. Not that I wouldn't do it, because I've done a lot of things that hurt.
and she didn't even cry. Right?
It's really, no, it's really good. So we numb you first on your face. Yeah, she cries at everything too.
She's
So emotional.
Like a winner.
So we numb your face first. We pull your blood. It's not an IV. It's a very tiny needle. That's the most painful thing that you're going to feel. The micro needling, you're not feeling superficially because you're numb from the lidocaine that we use. So once we take that blood, we literally, it doesn't even look like blood. It's a yellowish color because it's the platelet-rich plasma. And we would just kind of squirt it along the face and go across with the micro needle, really opening those channels of the skin. So it's essentially collagen induction therapy is what it is. So it's really,
how long is that treatment?
it takes about 30
long?
minutes. That one varies. So if you just do microneedling with like HA5, we'll put that all over your face, and then we'll do microneedling. That ranges anywhere from 150 to 300 depending on the area. And then if we pull your blood and inject that as well and do microneedling, that's 600. So, and we recommend about 2 per year. It really tightens. It doesn't take the place of filler or Botox, but it really helps collagen start turning over. So
Would you recommend that for somebody like me? I feel like I'm super young and I don't have any fine lines yet.
Or what? Or what would be your alternative, Brandy?
I don't know, because she said
Older
Botox is
Older ladies?
preventative. And
do you consider us old?
Yes, she does.
Never. Mother's age.
no.
72, you're done.
We're like giving up on Botox. Forget about us, Taylor.
I kind of get backlash from my friends, and I'm like, I feel like I need a couple of units of Botox. And
But
they're
I feel like I think you look great. I think it's never.
You guys look great too.
I don't think it's ever too early to start. You can never start taking care of your skin too soon. That goes for anybody. I mean, using sunscreen, vitamin C, and retinol, all of those things, you should be starting now. Do you need a vampire facial?
No.
Maybe not, but I think
not.
always using good skincare products will take you a long way right now.
Maybe
Maybe we should do a live demo of, not tonight, but we'll
you guys,
do.
we're gonna go get the PRP.
What if we did a live vampire facial?
Yeah, I want to do that.
Do you guys want to see something like that? Do we
Let
get
us
live?
know if you want to see that, and we can always do a live vampire facial. Everyone can watch, pull the blood, all those things. And we usually post things like that on our Instagram stories. So if we're not too busy during the day, we'll try to like catch a couple of patients that we can show those things. So you can always watch us there. But I think we should do a live.
I think so.
Let's do it. Yes. Okay, so we're going a little over on time, but that's totally fine because I think we're getting some great material out of you and answering so many questions.
Really good job.
Good.
Really good job.
I've trumped
Really good
the
job. Do we want to go ahead and do a little Botox demo?
Yes, I think we should.
All right.
Okay.
So just as a reminder too, guys, while Taylor gets set up a little bit, we are going to offer 10 free units of Botox for this Friday evening. If you go to our Instagram, so Glamour Bar Denver, as well as Restorative Injectables, and like both of them, screenshot it, send it to us, you'll enter to win into 10 free units of Botox.
Perfect. Taylor, I'll ask you a few more questions while you're doing this.
Perfect.
We're
Are you
gonna.
leaving me? No, I'm just scooching over.
Do you want me in this chair or that chair?
Oh no, you're fine. I
Okay.
can come over on that side.
Great.
You have a viewer, Rebecca. She asked if the sunscreen is still on sale. Do you want to explain what she's talking about? And is it still on sale?
Yes, so our revision sunscreen is SPF 50, and that is still on sale. So you can purchase that at our website, www.restorativeinjectables.com, on our shop section, and that is on sale through the end of the month. So it's a really good sunscreen you can be using every day. It's not tinted. It's just really good base sunscreen. Men can be using it, so if your husband or boyfriend, you want him to start taking care of his skin, that's a really good one.
Awesome.
Okay, so I'll just kind of go through how we typically assess a patient. Lindsay, I kind of know her face, but it's still
I've never done
wonky.
Botox before.
So always clean the skin with a little bit of alcohol. And I'll show you guys this needle too once we start. So we will today just inject Lindsay in what we call the glabellar region, which is also the 11s, where you probably make that face when you're really like,
Where I like to be frozen.
that's so no one knows what you're thinking. So I always clean the skin with a little bit of alcohol just to make sure everything is totally prepped. I'm very OCD about the skin being clean, just because makeup has all kinds of stuff in it. So her skin's clean now, and I just always have patients make a couple of faces so I can see where those muscles are moving. So I'll have you pull down and frown so you can see, and I'll kind of accentuate this for her. She has this muscle right here in the middle, and that's called the procerus. That actually doesn't control anything in the 11s, but it does control that little horizontal bunny line. If you ever get that line where your makeup just sticks in there, that's the best muscle to inject to take care of that. And then the corrugators are these muscles, pull down again, are the muscles that actually make the 11. So we'll inject these on both sides, both corrugators. And for Lindsay today, pull down and frown. We'll do about 14 units, and that will completely take this away from her. And I know she wants that because I know her. Not all patients want that. Maybe someone just wants to not be able to pull a little bit. so it may be a little less, but the average in this area is about 20 units. So we're still well below average, but we know from previous experience that this takes care of it for us. So we'll pull this up.
Taylor, how much is a unit, and how much does that cost as well?
So it's $11 a unit. And then we're going to do 12 units for her. So everyone's different. So depending if we did 20 units or whatever the case may be, for Lindsay, we're going to do 14, and that would be at $11 a unit.
Awesome.
So what is that?
I don't know.
What's
144?
Yes, 144. Like I said, we ain't no math wizards, but
Did you know that?
No, did you see the look of confusion
I thought you were asking
she had?
me because you thought I didn't know.
It
I
is
didn't.
I was trying to put you on the spot.
I can
I'm
count
on the
units,
spot.
but I can't count.
So Allergan's the maker of Botox. I'll do a shameless plug for you.
Yeah.
They have a rewards program called Brilliant Distinctions, and that you earn points, and like they give coupons and all sorts of like awesome stuff throughout.
Okay, so I don't know if you guys can see, but this needle is tiny, 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 tiny needle. And then just watch Lindsay's face. Don't make it hurt, but it will definitely, you'll be able to tell how painless it is. So I'm just going to have you pull down and frown. Good, relax. Little poke here in the middle. Poke, big deep breath. Good. Pull down again. Relax. Little poke here, big deep breath.
Taylor, we have another question. What are the side effects of Botox long and short term? Are there any side effects?
Yes, hold on just a second. I'm gonna finish this and then I will definitely address that. Pull down again, relax. And then pull down one more time, relax. Perfect. And that's it. She's done. Little bit of bleeding, but most of the time it's gone within a few minutes. We would just tell her, make sure you stay upright for the next couple of hours.
I've been drinking some alcohol.
You don't need to. You don't need to rub it or anything like that. The biggest thing with the Botox is it doesn't kick in for a week to 10 days. So don't freak out if you still have a few wrinkles after a couple of days, because it's still going to go away at that week 10. So the short-term effects, what was the question? The long-term and the short-term?
What are the side effects of Botox, short and long term?
So side effects of Botox, the biggest side effect or the risk that I see is bruising. So anytime you're sticking a needle in someone's face, there's a chance that you're going to have some bruising there. Side effects, if you're not injecting in the right muscle, there is a side effect of what's called brow ptosis, or heaviness in the brows, and that's why you make sure you go to a really good injector that knows facial anatomy, because that's really what it comes down to, is someone who's conservative and is able to know facial anatomy and what causes those. So the biggest side effects with Botox is a little bit of brow ptosis, and that can be prevented as long as you're in the right area of the face.
I have another question, personal question, not for my personal self, but I've seen some things on like Instagram and Facebook forums and blogs and beauty bloggers. Does Botox help with migraines? I feel like a lot of people say that's why they get Botox.
It definitely does. So we know it can be treated for migraines. That's a totally different type of treatment. It's therapeutic Botox, not cosmetic. But if you want it for a therapeutic purpose, I can go in and just by injecting the glabellar, a little bit in this forehead muscle and kind of in through here, it will help with migraines depending on where they stem from. So if you are a frontal person and you get these migraines right here, just by injecting the glabellar, that is going to help with your migraines.
I like to be frozen because I make this face like all day long.
Mostly because she can't see, because she doesn't wear contacts or glasses. That's why she's always scrounging at people. And
it does help headaches. So I'll attest to that.
And next week you guys can do an after of trying to make
you guys
that
can
face.
all.
Yeah. Perfect.
Perfect. Before and after. Lindsay's face. Awesome. I think that's all the questions that we've had. So let's just wrap up with a few things. Just a reminder, Taylor will be here Friday the 14th from 5 to 8 p.m. And there's only a few spots left, so give us a call to make your appointment right away. Just do it right away.
And we're going to have HA5.
Yes, HA5. We're going to have HA5.
Nothing else. Just come for the lip plumper. If you have questions, more questions, we're all happy to answer them for you or give you like a consultation time with Taylor too if you're like not feeling 100% ready to like move forward. And then we'll have our custom lip bar going too, so we'll have lip glosses and lipsticks that you can make on your new plumped lips.
And we'll also have champagne. We always have champagne.
We always have shapes. Also, just as a reminder, if you follow Glamour Bar as well as Restorative Injectables, that's like a tongue twister for some
really is.
Restorative Injectables
It's like
on
Lashley.
Instagram. It's like Lashley. It's like you kind of start to tangle. But if you follow us both on Instagram and take a picture of it, send it to us. However, social media, email, whatever's easiest for you, we'll enter you to win 10 free units of Botox this coming Friday.
Yep, awesome. So we're just gonna recap as well. Any products sold through the month of April, 30% of that will go towards Hope for Lydia. Again, I'll post that Facebook link and GoFundMe link in our Facebook page and Instagram and whatnot. So you could go donate or you could come in as well. And yeah, we look forward to seeing Taylor on Friday.
Thank you for having me. So fun.
Thanks for coming. And then next week, we're super excited. Not that we weren't super excited this week.
I'm not near as cool as the person that's coming next week, but it's okay. I really like that person, so I'm okay with it.
Favorite people.
So one of our favorite Denver bloggers, all of you girls are our favorites, but Brittany Pillard's going to join us next week for Beauty and Bubbles to talk about kind of services to get done before photo shoots, what to look for in your photo shoots, what can enhance your photos, personally, professionally, what have you, and we'll kind of go over all of the services that she gets done here at Glamour Bar and answer any questions that you have. So again, feel free to send in questions ahead of time if you can't join us on Tuesday through any of our social or email, call in, whatever's easiest for you, and we'll be sure to address those all next week for you. Also, if you have any other questions about filler, Botox,
Yeah, you can always
all of
send a
Taylor's
message
tricks.
to me. You can message me on my Instagram or on our website. You can send an email, and we usually get back to you within the day or so.
And we will set up a vampire facial for you guys.
Yes, it's so good.
I'm in.
Has to be documented.
I'm in. I'm in.
It has to be documented.
All right, sounds good. Cheers, and we will
Cheers,
see
everybody.
you. Taylor,
See you
cheers.
next Tuesday.
We'll see you next
See you
Tuesday.
next Tuesday.
Cheers.
See you next